I'll be discussing and focusing on the Indian context. Now, we all know laboratory medicine plays a very crucial role in the treatment, in the diagnosis, and in the monitoring of the diseases. And for this, the key factor is harmonization of the tests and implementing standard procedures and standardizing the equipments along with the procedures which are implemented of the workflow in the lab. But it's fraught with large number of challenges. Apart from the technical challenges and apart from the regulatory challenges, there is a major challenge, that is the geographical challenge. We know that its importance is that it improves the patient care. There is cost efficiency because when there is harmonization, the patient don't have to go for repeat tests. Because whenever there is an error and repeat test, the onus lies on the patient. It goes from their pocket. And if we go for quality assurance, then uniform practices that enables easier implementation of the quality control measures across the laboratories. So what is the issue with the geographical part? Let me focus. Up till now in 2023, it's a data from NABL, in 2023, in India, 2022 medical laboratories are accredited. And if we zoom a little bit and focus on Odisha, only 21 labs are accredited. It's not that hardly 30 or 40 labs are not there in Odisha. Now I am again zooming a little bit more, concentrating on the western part of the Odisha. In western part of Odisha itself, there are around more than 40 labs, which is including your labs are private labs, the labs in the private hospitals, government hospitals, in your academic institutions, medical colleges. So more than 40 labs are there. Our lab got accreditation in 2021. And you'll be surprised to know, in Western Odisha, our lab was the first and it's still the only lab which is accredited. I'm talking about the whole of Western Odisha. So what are the challenges? What's pulling everybody? And they're not going for the accreditation or standardization, because if you are going for accreditation, that means you are going to implement the standard practice and you are going to implement the harmonization part. So what's pulling them? The key challenge is your resource limitations, infrastructure issues, and the training gaps. Now there's lack of advanced equipment. Many labs, they still struggle with the basic quality measures. There is unreliable power supply and there's inadequate storage facilities. Most of the labs in these setups, they still follow the traditional methods, the manual or the semi-automated methods. And what happens? These methods, they are less precise and they are more prone to human errors. In the automated systems also, some labs do have automated systems, but they are using different calibration standards. So it's not that all the labs are not on the same level. We are not having the same level field. Infrastructure. Now just if we move from we are a tier B city. It's very easy said and easily done in tier 1 city. But in case of tier B city, or when we just move from urban to suburban area, so there the facilities are different. You cannot just think about that there is a power shortage still now in some areas. So what happens? The equipment performance, that deteriorates. The quality of the sample integrity, that also deteriorates. So that is the main hurdle and challenge which the labs face. Internet connectivity. Now in 2023, you must have been thinking internet is available. But still, there are areas where they face the challenge. Continuous internet facility is still not available. Many are still following the manual method, that is, they're writing the reports manually. They cannot go for a software LIS system. When there is a problem in internet facility, you cannot go for a LIS system. They cannot afford that. So there is issue in those labs. In such type of cities and such type of areas, there is issue in these labs. the workforce. They are the backbone of our lab. There's a training gap. Inconsistent training programs are there. So what happens? We don't get skilled lab technicians. Whoever they are skilled, they go to other cities. They need more of growth. So what we are left behind with? The low skilled and the unskilled lab technicians. Now here I will be sharing my experience. In 2019, I started associated with this new hospital, JP Hospital, and they started the lab there. The technicians, like still now, the technicians with whom I had to interview, they were totally they were trained in such type of institute where they had never seen a semi-automated machine. That is the scenario of that area. And I have to hire these technicians because I cannot get some other technicians from outside. Because the good technicians, they will go out. They won't come back inside the tier B city. They will go to some tier A city or 1 city. So I have to train these persons. They have to work with me with this type of institute. So these trained staff we don't get. There's lack of these ongoing training sessions also. Like we have these CMEs and all for doctors, but for the technicians, there is no such training sessions. They even have never heard the word of NABL, they have never heard of harmonization, they have never heard the term standardization, they have never heard all these terms. It's like zero for them. So you have to deal with such type of technicians and in these areas. So this is a major challenge for many of the areas of India. Now, they were phlebotomists. Now, when I asked these phlebotomists, how many samples you have collected, they replied only one. That is, during the training session, they collected the sample of their friend. That is what they were training for 2 years. So, you have to train these technicians when you hire them. Documentation errors. Most of the labs, they do not document the errors. There is no improvisation of these errors. And still, it continues with such type of labs. Quality control. Most of the labs, they do not practice the internal quality control. They do not participate in a ICAS. Like the area from where I come, most of the labs, they have never heard the term ICAS or ILPT or IQC. So, when I have to send a sample of one patient, like I have got some error in a sample and I want to check the sample with some other lab, whom to rely? I cannot send the sample to any lab nearby me. I have to send the sample outside. The nearest place is Bhubaneswar, or it's Calcutta, or it's Mumbai or Delhi. Bhubaneswar means it's a one-night journey. So I have to wait for the sample visit for 2 days or 3 days. Will the clinician or the physician wait for the report? No. But I cannot rely on any lab because they are not accredited. It is not standardized lab. So these are the issues we face there. And these are the issues most of the labs there face. Yes, one more thing. The reagent. About the reagent, there what happens, the labs, they use substandard reagents. You can say the substandard reagents. They perform the test. And what they charge? Minimal amount. So what happens? Most of the public people, they are more concerned about their pocket. It's fine, they have to be. Like in my experience that when I started, the charge for CBC was 350 by me. It was like management and myself decided it should be at 350. The next day, one of the physician called me up complaining, "Arey, you kept the price of a CBC at 350. The patient is complaining that outside it is at 150. And I am losing the patient." Now, if I lose the patient, one thing is clinician is blaming me, the management is again blaming me. Whom to answer? Because outside, very less amount, they are able to perform those tests. Public won't understand what is quality. They won't understand that. Now the biggest part, accreditation. What is the hurdle there? My experience. We went for the reassessment some 3 months back in the month of June. Actually, it was scheduled in the month of April. But what was the issue? The place where I stay, the nearest from where the assessors can come is from Calcutta, Ranchi and Bhubaneswar. One more thing. In Odisha, there are no pathologists who are assessors. The pathologists are not, means all the pathologists, assessors, they are either from Calcutta or Ranchi. So none of the assessors agreed to come to our place for assessment. And it took 2 months to just arrange some assessors to come and reassess our lab. And it got delayed. Shortage of assessors are there. So this was a great hurdle for us. So these were the challenges which we as a tier B city and all the other labs in that city face. And that's what pulls them back. It's difficult to pump more finances for this. The management never agrees it because ultimately there is ROI they have to calculate. It's difficult to answer them, convince them, then go for quality. But with challenges, there are solutions. The solutions which can be met in 3 sets, like we can achieve this with 3 goals. It should be a short-term goal, there should be some medium and the long-term goal. If you want it to be placed in a global stage, the labs of India should be in a global stage. Short-term, there should be more of all the national guidelines that should be according to the India. So it will be equal, all the reference values and everything will be equal for them. Second is that there should be mandatory accreditation process. If you make it mandatory and make it little bit easy for the labs, then they will go for accreditation. And they have to go for accreditation. So it will be level field. Second, there should be some more of regional centers should be set up so that the training should be better for the technicians. Doctors are well trained, but what about the technicians? Because they are the backbone of us. So they have to be more well trained. As I said, the accreditation should be mandatory. Then it will be easy to play. Second is, there should be some incentives. Now, why I say incentive? Now, you all know about Ayushman Bharat. Likewise, in Odisha, there is a BSKY. Of course, now because the government changed, the name has changed. These are the cards which are given to the patients. In Ayushman Bharat, very less patients, means very low number of patients are included. Okay? But BSKY, more than 90% of the patients have this card. More than 90%. So every hospital have to apply for this BSKY or else it is not feasible to run the hospital. So what was the incentive for them? The hospitals, those who had NABH entry level accreditation, they were getting more than, means around 20% more package than who are not having NABH. And those who are fully accredited of NABH, 30% package. So it is okay with the hospitals. They can cater to large number of patients. There is a good amount because they are putting money for quality. So they're agreed and it's easy for them. But what about lab? The package includes the bed charges, the lab, the fooding, the medicines. So why will the hospital think about lab? Is there any incentive? Because they're also putting some money for accreditation. They're putting for some money for standardizing the lab to maintain the quality. So if there is some incentives from the government side for the lab people, then there is chances that more of the labs will be motivated and interested to go for this standardization process. Then there should be harmonized reporting formats so that the errors can be reduced and the result can be perfect. The last part is education. There should be a development of nationally recognized training programs for the lab professionals. Along with that, some online modules should be introduced. Now, modules which must be customized according to the technicians. We cannot place all the technicians, including your senior technicians and junior technicians, in one classroom. So it should be customized. Senior getting advanced training, juniors getting the basic training. So they should be motivated and encouraged to go into training, either online or going some CMEs. Some mode of CME should be organized for these technicians in these places. Now, this is my histopathology lab, histopathology department. In the lab medicine, we frequently have such type of trainings. Me and my colleagues, we frequently organize this training. One more problem in those places are like, in my area, 90% of the technicians cannot understand English. More than 50% do not understand Hindi. So we have to give the training in their local language, that is Odia. Just imagine giving training regarding harmonization, regarding needle stick injury, regarding biosafety cabinets, regarding biomedical waste, regarding standardization, regarding everything, explaining the clauses to them in local language Odia. But if we don't do this, I cannot continue with this, with the accreditation process. So like we started, I joined 2019 till 2021. It was aggressive mode of training because we have to motivate them to change themselves, to get accustomed to the new type of knowledge, new type of work environment. And still we continue with this process because there are new technicians which are coming up who are joining and they have to repeatedly get the training. This is our nursing staff who is giving a training regarding this hand washing during the COVID time. Yes, ours is a hospital. We all know there are 3 phases and most of the errors is there in the pre-analytical phase. The samples we get from the IPD, which are collected by the nursing staff. Again, errors from the IPD patients, IPD samples. We used many hit and trial method. And then we came up with this sheet which was created by us, in fact, because I have to deal with these people. I wanted to reduce the errors in my lab. Here what happened, these are the station name of the nursing staff, nursing station areas. Maximum mark was 20, the minimum was 0 mark. This sheet was filled up by me or my staff. So if they send any erroneous samples or there is error from their side, we mark them. Whoever gets a maximum mark, we give them the reward. Like sweets, chocolates or something to that department of the nursing. And those who have minimum mark or there is some problem in them, we give a bedside training. We started such type of training now to the nursing also. Of course, now it has become easier because my senior staffs are able to go there and give a bedside training. It's not that we fill up the class and bring all the nurses together. We saw that this didn't work out. Actually, we had tried that also, but it didn't work out. Because most of the nurses, they are busy with the patients. They don't attend the class. Ultimately, we found the solution that we have to go to the bedside and teach them. That was the only way possible. So, of course, this has reduced the errors now and it really worked for us. So, my take-home message is that if we want to bring all the labs in the global stage and under one heading, there has to be a multicentric approach, a collaborative approach. And it has to be taken up by the stakeholders, the government, the physicians, the public and the social workers. Because of course, while giving the training, since last 4 to 5 years, our hospital has been organizing small camps and awareness program for the public to make them understand what is the importance of quality. Because they are skeptical, they are paying, so they are skeptical. Why should we go to JP and why not some other lab? So we organize such type of awareness program for them so they can understand the importance of quality. And implement the changes step by step, because small wins will build momentum towards full harmonization across India. This is my young, energetic and motivated lab technician staff along with my microbiology colleague. And this is actually on the occasion of the National Pathology Day, which we celebrated in our lab, so that these people, my staffs, will be motivated and they can understand and they will be more educated. Of course, there are 2 clinicians also who gave the talk on that and shared their views on this. Thank you for your attention.